Welcome to the Business Growth Spotlight, where we shine the light and talk with business leaders from all over the world who are here sharing their knowledge and wisdom so we can all grow together. I'm your host, Heidi Schalk, co-founder of HLH Growth Solutions, where we help businesses scale revenue using outside-the-box visibility strategies. And if you're new to the podcast, welcome. We're excited to have you here. You're in for a treat with my special guest today. But stick around to the end because we have a special gift just for you. Without further ado, let me introduce my guest today, Darren Klugman with CalmWave. So welcome, Darren, to the podcast.
Heidi, thanks for having me. It's a pleasure to be here.
It's a pleasure to talk with you today. So, Darren, can you start us off by telling us a little bit about yourself, about CalmWave, and your role within the company?
Absolutely, yeah. So I spent nearly 20 years in clinical medicine in pediatric cardiac critical care. So most of my clinical time was spent running cardiac intensive care programs, running pediatric congenital heart centers, and my non-clinical time was in clinical quality and safety, clinical operations, and risk management. So really spending a lot of time looking at ways to improve care delivery, ways to reduce patient harm, and mitigate risk when I wasn't taking care of patients, and then really working to build and develop high quality, really highly efficient teams to take care of some of the most complex, sick babies and children in the world.
Well, tell us a little bit about what CalmWave does, CalmWave AI.
Sure. So I joined CalmWave full-time in March of 2025, and CalmWave is really a patient safety and hospital operations platform focusing on improving care and safety for patients in the ICU. And CalmWave applies really, really simple solution to something that people outside of healthcare don't even think about, right? We think that if, God forbid, you wind up in an ICU, you show up, and the idea is obviously to get you better when you're in a critically ill state. And fundamentally, in order to do that, you have to be monitored appropriately. And it's shocking to many people to understand that monitoring patients in the most precise manner is really, really difficult, and it's getting harder and harder all the time. So CalmWave solves that solution. We use AI, mathematical modeling, and data science to optimize patient monitoring in the ICU to improve patient safety by reducing the likelihood that patients have serious physiologic changes that go unrecognized because the monitor parameters are set inappropriately, or because nurses and clinicians are so burdened by alarm fatigue that they hear an alarm and they ignore it or silence it, which often happens because of imprecise monitoring in the ICUs. So we are solving a very fundamental problem in the ICUs, which is imprecise monitoring leading to patient safety issues and tackling alarm fatigue along the way so that when clinicians and nurses hear alarms, they know that they're important and they should be taken seriously.
So your AI platform, CalmWave, is reducing non-actionable ICU alarms, and you're gaining traction because you're showing a 58% reduction in alarms. How do you see this impact shifting hospital operations and clinician well-being?
Yeah, so I think one of the things that has been really eye-opening to us is that when you talk to teams in ICUs, teams in emergency rooms, teams in hospitals in general, but certainly in ICUs, since the dawn of time, since we had devices that make noises, people had believed that noise in these ICUs is the cost of doing business. It's part of what we deal with. You walk into an ICU, it's incredibly noisy. You talk to patients and families of patients in the ICU, they'll tell you it's unbelievable, the noise, right? There are certain ICUs that put noise monitors in the units to understand the decibel levels, and the decibel levels approach concert levels at times, depending on where you are and what the ICU situation is. So that's one big part of it. The noise is a big problem. And what that noise does, the constant drone, it desensitizes people to important noises, right? And what also is most important about it that we don't actually think about is that what is the point of those noises? Those noises are not there to drive people crazy. They're not there to alert you that you need to go get more coffee. Those noises are there to alert you to something important changing on the patient. And so when you become desensitized to noises that are designed to help you keep patients alive and safe, that becomes a real patient safety problem. So the reduction in non-actionable alarms, yes, it's making ICUs quieter, but the most important thing it's doing is making them safer. Because then too often I've watched scenarios where nurses and physicians walk into a room that's alarming, they silence the monitor and walk out, or they silence the monitor and start fiddling with a device, never looking at the patient that might be actively dying or having something terrible happen to them, and they're not paying attention because they don't believe that the alarm represents anything important. So the non-actionable alarms are a surrogate for real patient safety improvement. And the drone of noise that people hear all the time is a significant contributor to patient harm.
So you share with us your experience and your background, and you've been in the ICU before you joined CalmWave. So what ways did your medical experience reveal gaps in the existing solutions? And how did you translate that into CalmWave's vision?
Yeah, so having spent my time in pediatric cardiac intensive care, the majority of our patients are from birth to 2 years of age. So you can imagine that those patients can't talk to you. They have no ability other than their vital signs to show you that they're in distress often. The level of stress and anxiety is unimaginable that their families and caregivers go through. And so coupling that experience and watching the shock on families' faces when an alarm is going off for their newborn who's just had open heart surgery and someone walks in the room and silences the alarm and walks out. And the family's sitting there saying, wait, hold on a minute, Heidi, I thought that alarm means something important. And the doctor or the nurse says, oh, no, don't worry about it, it's nothing, and walks out. That erodes trust in the system, and it makes one wonder, what is it that we are fundamentally doing in these ICUs? So as soon as I learned about CalmWave and met our CEO, I knew that we were onto something really, really important here, because there is a need to make ICUs less noisy. But the need to make them less noisy is not because we don't like beeps and constant sounds. Those are annoying. But we need to do it because right now, we've reached such a point that those beeps and sounds don't mean anything to anybody. And yet they are exactly what we are essential to us in order to understand when you're in a unit with 30 beds and you're one physician or you're one nurse taking care of 2 or 3 patients, what is going on with your patient? Number 2, the beeps and noises and alarms are only increasing because over the last 20 to 30 years, the technology explosion in hospitals is real. And with every new implementation of a new device, a new technology, a new software package comes what? More alarms, right? Our patients are more complicated. Our disease processes are being cared for in a more sophisticated manner. And we have more devices being utilized to keep patients alive and help them get better than we ever have before. And all of those devices generate noise, right? So now we're in a position where we are asking clinical teams to take care of sicker, more complex patients with more devices, right? And at the same time, synthesize and integrate all of that information in a very dynamic, rapidly evolving environment. It's impossible to do. And so CalmWave comes in and solves one of these problems and says, hey, we're going to use math and data science to ensure that the patient monitoring parameters in your ICUs are appropriate so that when there's an alarm, you know it means something and you should pay attention to it. And once we do that and we reduce the cognitive burden of the clinical teams, now they can spend more time with their hands on the patient, taking care of the patient, rather spend more time making sure that they're giving the right medication to the right patient at the right time. Spend more time to actually make sure that the ventilator is delivering ventilation and oxygenation the way they think it should be, right? So no longer do you ever have to ask yourself, is this patient appropriately monitored? We can make sure that happens so that you can take care of things that require a lot of time and cognitive load.
I'm so glad you're here, Jake, because I knew nothing about this. And I don't have, luckily my children didn't have any issues when they were young. But I can't imagine being one of those family members or parents, with that happening to an infant or a toddler, let alone regardless of, whether you have your elderly, family member there, whether it's your mother, your father, your sibling, your friend. You definitely want, the care given to your loved one, and to watch that would be corporate.
Yeah. Yeah, and it's not. Yeah, and like you said, it's age independent, right? There's
Right.
there's growing body of literature to support the notion that noise is bad for you, not just when you're sick. Noise in general in one's life is not good for you, and particularly so when you're in an ICU environment, right? This is why people get psychotic in ICUs. This is why there's literature to suggest that every day you're in the ICU, your likelihood of recovery is reduced. And contributing to that is all of the noise and the inability of these teams to understand with certainty that they're monitoring their patients appropriately.
I like to talk about the importance of physician leadership, because you were in the hospital, you were in the ICU, and you, as a physician, and you saw a gap. And when you met the CEO, you were like, this is amazing and I want to be part of it. So why do you believe that physician leadership, especially physicians with deep clinical experience, are critical in health tech startups, or in health startups, regardless of whether they're
Absolutely. This is the time more so than ever to invite and welcome clinical expertise into this space. More so than ever, this is essential, because I think the time that we're seeing in healthcare right now, with this explosion of startups and notably AI technology, where it's everywhere, right, is akin in many ways to the internet boom in the early 90s, right? Everything was happening at a rapid pace that people couldn't come up with. And there's going to wind up being a similar scenario in the healthcare industry right now, where you're going to have a big pile of rubble with the broadcast.coms and the pets.coms in the early 90s that were major hits that fizzled into nothing. And there's going to be a handful of success stories and survivors in this industry. And I think one of the differentiators for this is going to be those companies that recognize the importance of early physician leadership and engagement. And the reason being is that you can have the most brilliant solution, and healthcare systems are inundated with, everywhere they turn is the next amazing AI solution, software solution, new hardware that's going to revolutionize care. And differentiating which ones are truly going to revolutionize care and which ones are a flash in the pan is difficult for the health systems, especially in this era of funding uncertainty, changes in Medicaid and government engagement and funding. And on the other side of it, on the healthcare startup side, the most brilliant solution, without a deep understanding of what is it that inside the hospital, the clinical teams, the C-suites, the risk teams, what is it that they need? What do they want? Right? It might be that the solution is brilliant, but if it doesn't integrate in a manner that is effective for them, it's not going to work. And there's no replacing the deep understanding of what it means to be on the ground, right? The old adage is, I really believe is true. If you've seen one health system, you've seen one health system. Every system is a little bit different, and the healthcare industry is unlike any other industry. And so one success as a founder multiple times over in one industry trying to make an entree into healthcare doesn't guarantee anything. So from the understanding of deep understanding of hospital operations, if that's the space you're in, to go-to-market strategies, to understanding the importance of science and research to really drive engagement and drive outcomes, all of those things only come from living in that space. And that's where physician expertise can deliver.
Yeah, you can have the greatest idea, but if you're not internally working on it, you need somebody on the inside. So I agree with you. Who knows better than the physicians that are seeing the gaps to every single day, and talking with those healthcare professionals who are in it and doing it, and and seeing what's going on every day. So what specific skills, now that we know that we should have physician leadership in these startup companies? What specific skills, insights, or clinical instincts do physicians contribute in product design, regulation, or strategy that, say, non-clinician founders might miss along the way? And I think you touched on some, but
Yeah, so I think a big part of it now is really understanding. The first question is, right, like, is need. Like, what is it that you're solving for? And what is the actual need for the system, for the hospital, for the ICU, for the patient, for the nurse, right? You can take it down from a macro level all the way down to the smallest micro level you'd like. That understanding is really important. What is it in terms of healthcare economics that really resonates with C-suites right now? There's a tremendous amount of uncertainty, right? And there's a limited amount of money for these health systems to invest in new solutions. And this is the time where I think, in spite of all of those challenges, this is the time where health systems are going to differentiate themselves by really innovating in the right way. And that's what physicians can bring. Now, the challenge, Heidi, is the following: that, people who trained when I did, and hopefully it's changing now. There's a lot of discussion about this. We were never trained in this way. We weren't trained to think about healthcare economics. We weren't trained to think about the intersection of healthcare delivery and finance. We weren't trained to think about the intersection of healthcare delivery and innovation. I grew up in an era where we wrote our notes on paper and wrote orders on paper. And our first, entree into this changing world that we're in now was the advent of the electronic health record. And people were kicking and screaming when that concept came about, right? So that's one of the big challenges that we have, is that there's not a lot of physicians who understand this. There's not a lot of physicians who want to be a part of it. And we have yet, until recently, I hope, actually trained physicians to say, hey, there's a role for you here, and a really important one. And it can be part of your life as a clinician while you're practicing medicine. It doesn't have to be an either or.
Yeah, I was just going to ask you, why aren't more physicians leading health tech ventures? And I think you just shared because they don't understand it, or are there any other reasons than what you just shared?
I think there are a few, actually. I think you could talk to a bunch of folks like myself and probably get some slightly similar and perhaps different answers. I think we haven't been trained. I think people are in medicine often, and it depends on what space you practice in, but often we are trained in certainties, right? You have this problem, this is the diagnosis, this is how you work it up, this is how you treat it, right? When you step into the startup space, or into the business world, or into the venture capital space, that's not always the way it is, right? So you have to be eminently flexible to understand that if this is not working the way you think it is, you got to pivot really quickly. And everything is a shade of gray. There's very few absolutes, especially in this rapidly changing environment that we're in. That's hard for a lot of physicians to manage. Humility is incredibly important. And you have to be humble enough to say, I know this, this is working, this isn't working, I'm going to pivot off of it. Hey, look, I know I'm really good at this, but I've also had limited experience in thinking about go-to-market strategy, so I'm going to need some help here, right? That's not always intuitive for physicians to be able to come to the table with that sort of humility. And I think it's going to be very interesting to see what happens over the coming years, because we're in the midst of a tremendous crisis on the other side that we haven't touched on at all, which is physicians and nurses are leaving the field in droves. It was sort of a tipping point during COVID, or a bunch of hundreds of thousands of nurses left the field because of challenging work environments and a number of other things. Important departures out of the healthcare space are happening on the physician side as well. And with that, the healthcare system is going to be more stretched. Patients are going to suffer. And it might also drive more physicians into the startup space in a willing or unwilling way. And how that unfolds is to be determined. But I think there's a number of reasons why physicians are challenged sometimes. And then the final one is they're scared, right? A lot of physicians are really unhappy and they want to do this. A number of people who reach out to me and say, wow, this is amazing what you've done. How did you do it? And the first is to say, do I have an aptitude for this? Is this something I'm interested in? And if you believe it is, sometimes it's a leap of faith. You just got to take the leap and give it a whirl and see how it goes. But there's a lot of, it's not an easy thing to do. And it takes some courage to do it.
Yeah. So from your own transition from now you're in, working with CalmWave, what challenges did you face stepping away from clinical practice into a startup leadership role? And how did you overcome those challenges?
Well, a lot of what I just talked about, I speak from experience, right? One thing that has never scared me is failure, right? I'm a big thinker. I am very confident in what I am able to bring to the table. And I'm also incredibly quick to admit if I've made a mistake, if I don't know. When I would round in the ICUs, I would look at everybody on my team. And if the patient wasn't doing well or I wasn't sure, I would look at everybody and say, what am I missing here? You know, everybody from the respiratory therapist to the fellow to the nutritionist, I'd ask the parents if they thought we were on the right track. And if I was wrong, I would admit it. I would say, look, I think we've made a mistake here and we're going to have to double back and redo some things. And I think those character traits are incredibly important. And I applied all of those when I made this leap. I was very burned out. I knew I needed a change. I've never been happier in my life, and I wish I'd have done it a decade ago. And so you have to go into it with that mindset. The other thing you have to do is one can't listen to this podcast and say, oh, well, Klugman said that we need a bunch more physicians in the startup space, and there's a startup that says they need some physician help, so I'm going to do it. You have to be very self-aware and understand where is it that your expertise will be most impactful. And that requires introspection, on an individual level. In order to be successful, you have to wind up in the right place with the right team, and that takes a lot of work. So, if you approach it in the right way and you have the right makeup, this will be a tremendous experience. And I think you have to go in eyes wide open. You have to go in with a lot of humility and a lot of flexibility.
So I'd like to pivot a little into growth, especially with learning. I'd love to learn more about CalmWave and how the company has grown since you've been there or since you've seen the evolution of the growth. In order to, keep going, in order to achieve the goals that you have, you need to put the product out there. So let's talk a little bit about that. Is CalmWave, getting in front of the hospitals or the ICUs for them to use your product? And as far as marketing goes or visibility, what has been working for you? And then maybe on the flip side, share with us some things you've tried that maybe haven't been as effective, if there are any.
Yeah, absolutely. So I think one thing that's really important in the healthcare sector is that marketing is a results-oriented endeavor, right? Healthcare decision makers are not interested in flashy flyers and slick swag. That's fine. People will take it, but at the end of the day, it's about results. It's a results business. Are you delivering on what you say you're going to deliver on, and do you have data to prove it? And so I think that's the space that we're really embarking upon now. So we have one of the largest hospital systems in Georgia as a customer, and we're now advancing and working on our roadmap to spread throughout that system and generating scientific evidence to prove what it is that we're doing. You've mentioned some of it. We now have an abstract that has been submitted, which is demonstrating the important patient safety gains as a result of implementing CalmWave. And we are in conversations with a number of other large health systems in the country to implement our software technologies in their systems because of what it is that we've been able to demonstrate with our current customer. So it's a results-oriented business, and that's the be-all and end-all of what it is that one has to do and what it is that we are doing with CalmWave. The second thing that is really exciting for us is that this technology is something that, while very powerful in its simplicity, right? The data science and the AI and the math is not simple. The solution to say, we are going to use patient vital signs and trend those vital signs to ensure that we most appropriately monitor each patient based on that patient's unique physiology, demographic, illness, disease state, et cetera, is really unique and has wide applicability. So there's a lot of interest in what we're doing from the monitoring companies themselves, because right now those devices in the bedside monitors, they're not a lot different than a monitor that you can buy on Amazon or Best Buy or Costco to display a bunch of numbers. But you embed the CalmWave software in it, and all of a sudden it becomes a smart device that actually improves patient care, that actually makes things safer. So we have a lot of different avenues to really deliver improved patient care, improved safety and operations, and that's super exciting for us. So over the next 3 to 6 months, our goal is expansion across additional systems, as well as looking at opportunities to partner with other industry leaders to apply our software technology solution in a way that really improves patient safety and ICU operations.
How are you going to be connecting with those business leaders?
So those inbounds are coming because of the success that we're having and because of the recognition that we've developed something that is not easy to develop. And I think that's one of the things that's exciting about our company, is that the technology comes out of enterprise IT in outside of the healthcare space, and applying that deep expertise in healthcare, where there are large siloed data streams that have never been integrated the way we've been able to integrate them before, from the EHR, from the middleware, from all of the devices, put them into what we call our common signal format, and then make those data tangible and accessible for the clinical teams making the decisions. And one of the most important things that I think we've been able to do, which I believe is critically important. The last thing clinical teams need right now is another data point. The last thing clinical teams need now is more data to analyze. And we do the opposite. We take disparate siloed data streams, we put it into a manageable format, and we ask people to analyze nothing. We don't give you any additional data to analyze. We, in fact, take existing data and make recommendations about ways in which those existing data streams can be optimized, namely patient vital signs.
So what's next for CalmWave, Darren, like the next 12 months? What are the big goals? You mentioned
oh yeah, big time. I mean, I envision us revolutionizing patient safety and operations, both in the ICU and then on the hospital level, frankly, because the power of this platform starts in the ICU because of the vast amount of continuous data streams that one can get from there. But the applicability goes well beyond that into telemetry spaces, into acute care floors. And frankly, we have had quite a bit of interest in using this technology to understand ways in which one can monitor patients at home on medical devices, which is a hugely important space that's growing at a rapid pace. And so I envision that over the next 12 months, CalmWave's influence on care delivery and our footprint is going to grow substantially because of the value that we add and the way that we are able to make historically siloed and inaccessible data very tangible and manageable for teams to really improve patient safety, improve patient care, and ultimately improve operations for the systems, which is what this is all about.
Yeah. So if a couple more questions for you, Darren. If I could give you a magic wand and you can wave it over one challenge, one issue you're having right now that could possibly hold you back from achieving your goals, what would that be and why? Is there one that you could see?
I think there are two major ones that I think are a tremendous challenge for healthcare right now. One is that we've talked a little bit about what I believe this to be a tipping point in healthcare in America, and a critically important time for a number of reasons. We are in the midst of a massive staffing crisis with nurses and physicians. We have care delivery challenges. We don't have enough beds. We don't have enough staff for those beds. We don't know where our funding is coming from. The challenge we're faced with is we cannot solve new problems with old ideas. Everybody loves technology and innovation until they have to change. It's time for healthcare to start changing. We have to innovate. We have to start thinking differently to tackle the problems that we have, because the challenges that we're faced with are so important. And at the end of the day, if we can't innovate and really think creatively and in a forward-thinking way, our patients and the broad health of the US and frankly the world's patient populations are going to suffer as a result. And so I want that to change. And I think companies like CalmWave are the companies who are going to do this, right? Applying what we have, using the data we have to innovate and demonstrably improve patient care so that care delivery for our patients is better and the hospital systems function more efficiently. And the second thing that we have a big issue that we need to sort through is interoperability of all of the connected devices that we're dealing with. The electronic health records have no interest in playing nice in the sandbox and integrating in a meaningful way with software solutions, with new hardware. There's a growing amount of hardware that has to integrate. It's a tremendous burden, and we're asking an increasingly inexperienced staff, nurses, physicians, advanced practice providers across the spectrum to integrate an exploding amount of data and also then have all of those different software platforms and hardware solutions integrate in a seamless way. That right now is a major challenge for us. If I had a magic wand to wave over it and have all of those things integrate in a seamless manner and make it easier for the teams to do the right things, that would go a long way. And that's one of the really unique things that CalmWave has been able to do. We take all of those data streams from the devices, from the middleware, from the monitor, and integrate them in a way that makes them tangible and actionable. We need more people who are able to do that, and we look forward to leading the way in it.
I see that happening for sure. So, Darren, can you tell us, let everybody know how they can connect with you and learn more about CalmWave?
Absolutely. You can take a look at CalmWave, CalmWave.ai on the internet. Come to my LinkedIn page on LinkedIn, Darren Klugman. CalmWave on LinkedIn as well. For anyone who's going to be at the HLTH convention conference in Vegas at the end of October, we'll be there. And anyone interested in connecting, we'd love to connect and learn more about what you're doing and how we could be a solution that can improve patient care.
Thank you. So for all of you listening, if you're watching us on YouTube, Darren and I say thank you. Please share this episode with anybody that you know would benefit from learning more about CalmWave so we can support them in their growth in saving more lives in the ICU and also supporting the physicians and nursing staff that work inside of the ICU. If you're listening to us on your favorite podcast platform, thank you. If you are so inclined, we'd love a review. If you can hit that 5 stars, that would be great. That allows the podcast platform to share this episode with more people. And that means more people are learning about CalmWave and Darren. I promised y'all a gift, so here it is. If you're looking to grow your visibility, Darren had shared some things that they are doing in their field, and you've been trying different things and it's not getting you to where you want to be, then go ahead and download our Spotlight to Scale blueprint. You can go to spotlighttoscale.com/blueprint and grab that. Darren, before I let you go, is there any last words, anything you'd like to share that I didn't get to ask you or we didn't touch on today?
No, I think this was tremendous, Heidi. I just want to say thanks to you. Grateful to be here and really grateful for the work that you're doing. We need people out there highlighting innovation and new technology and leadership that can make a difference. So thank you.
Thank you. Thank you for your time. And I'm grateful to being able to have this conversation with you because I learned a lot that I had no idea about with your product and your company. So thank you for taking the time out of your busy day to be with us.
Thank you, Heidi.
Thank you all for listening to Darren and I will look forward to seeing you on the next episode of the Business Growth Spotlight.